My name is Ilaria. I've been coping with systemic sclerosis for about 25 years. So when I got the diagnosis, I was pretty young. Rare diseases have few patients, but we have to consider that in Europe, more than 30 million rare disease patients live. So we are a lot of people. The European reference networks are different because it's not just one doctor. It's a pool of doctors. And usually patients have to travel a lot, also abroad, out of the national borders to receive a diagnosis. With the European reference networks, it's not necessarily to travel anymore because there is a virtual platform and the doctors belonging to the reference networks, they could enter the data on this very secure virtual platform and ask the cooperation of their colleagues spread around Europe. So it's the information that travel, not the patient. At the beginning, back to when I received the diagnosis, I read that I would live just 5 years. So you can imagine how desperate I was, like all the patients that received such a diagnosis. And I found that there was a patient organization. I approached them because alone you can go, but with somebody else you can go further. We have 24 ERNs, and each ERN has the so-called sisters diseases, which are similar one to each other. I represent the patients affected by the conditions of my ERN, Reconnect. The first aim is to make patients' voice heard by policymakers, institutions at a national and international level, and also by clinicians. Another aim is the integration of European reference networks in national healthcare systems. I am very proud of what has been done in 2019, which is the state-of-the-art of the clinical practice guidelines for the diseases covered by Reconnect. And I had to collect them, and they have been published on a scientific journal. So the patient perspective on the patient unmet needs has been considered and published. Now, I must say I'm very happy because I have almost a normal life with many difficulties, but I don't want the disease or the difficulties to stop my life. I love to travel, to work with other patients, to try to build and shape a better future for people living with rare diseases.